Hello YouTube and MPH 6040. My name is Mike Hammer and I am a Masters of Public Health candidate at Western Michigan University. And today I would like to talk to you about the global health concern of multidrug-resistant tuberculosis. It's a disease caused by a bacteria known as Mycobacterium tuberculosis. It is most often found and affecting the lungs. TB is spread from person to person through the air, and about 1/4 of the world's population has latent TB. However, the purpose of this presentation is to focus on multidrug-resistant TB. MDR-TB is a form of TB that doesn't respond to isoniazid and Rifampin, which are two of the most powerful first-line anti-TB drugs. MDR-TB is treatable and curable by using second-line drugs. However, second-line treatment options are limited and require extensive chemotherapy, up to 2 years of treatment. These treatment options are very expensive and can be toxic. The World Health Organization estimates that there were 600,000 new cases of TB with resistance to rifampin, of which 490,000 had MDR-TB. The MDR-TB burden largely falls in 3 countries: India, China, and the Russian Republic, which together account for nearly half of the global cases. About 6.2 of the MDR-TB cases had XDR-TB, or more commonly known as extensive drug resistance. So using data from the World Health Organization, I created this GIS map inside of Tableau, which shows the 3 countries in question: India, China, and the Russian Republic. So in India, which is the most, is showing 37,285 confirmed cases of MDR in 2016. China is showing 10,898, and the Russian Federation for the same year is showing 27,363. What is the extent of the problem? TB occurs in every part of the world. In 2016, the largest number of new TB cases occurred in Asia, with 45% of new cases, followed by Africa with 25% of the new cases. So an additional graph that I created inside of Tableau is this bubble chart. The bubble chart actually shows for Southeast Asia in 2016, 46,269 cases of confirmed multidrug-resistant tuberculosis. Africa, for the same year, shows 27,828. So continuing on with the extent of the problem, tuberculosis is one of the top 10 causes of death worldwide. In 2016, 10.4 million people fell ill with TB, and 1.7 million died from the disease, including 0.14 million among people with HIV. Over 95% of TB deaths occurred in low and middle income countries. 7 countries account for 64% of the total, with India leading the count, followed by the Russian Republic, China, Philippines, Pakistan, Nigeria, and South Africa. In 2016, an estimated 1 million children became ill with TB, and 250,000 children died from TB. TB is the leading killer of HIV-positive people in 2016. 40% of HIV deaths were due to TB. Globally, TB incidence, however, is falling at about 2% per year. This needs to accelerate to about 4 to 5% annually to reach the 2020 milestone goal of ending TB altogether. An estimated 53 million lives were saved through TB diagnosis and treatment between 2000 and 2016. I used Global Health Observatory Data Repository. All of the visualizations that I created were done in Tableau. What was the result or the methodology of the vlog itself? It was really to provide awareness of the serious global problem of drug-resistant TB and the real threat to global health. WHO recommendations aim to speed up detection and improve treatment outcomes of MDR-TB through the use of novel rapid diagnostic tests, cheaper treatment regimen. Some additional solutions to control drug-resistant TB are to cure the TB patients the first time around, provide access to diagnostic tests, ensure adequate infection control in facilities where patients are treated, ensure the appropriate use of recommended second-line drugs, and antibiotic stewardship. The success of the strategy will depend on countries respecting government stewardship and accountability with monitoring and evaluation, strong partnerships with civil society organizations and communities, protection and promotion of human rights, ethics, and equality, and the adaptation of the strategy and the targets at country level with a global collaboration. Thank you so much for your time.